Tonight, the nation is on a war footing. Have we reached a turning point in this battle? On the phone right now is the former FDA Commissioner and CNBC contributor, Dr. Scott Gottlieb. Doctor, welcome back. It's good to talk to you.
Thanks for having me.
It's been a very rough week, but how about that question? Have we reached a turning point?
I think we know approximately when this is going to end. We have weeks to go here. Cases are going to continue to build in New York City and the other cities that have gone first, San Francisco, Seattle, maybe New Orleans, and then you're going to see cases start to build in other cities like Chicago and Washington, D.C., and perhaps Boston. That might be a few weeks behind. But for the cities that are a few weeks behind, they probably implemented the tough mitigation steps earlier, so hopefully their epidemics and their outbreaks won't be as big. For the cities that didn't implement the mitigation steps while this was spreading, unbeknownst to them in some cases, they're going to have larger outbreaks, and New York's included in that. New York probably had thousands of cases 2-3 weeks ago, and it wasn't being detected. The hospitalizations that you're seeing now are people who got infected a couple of weeks ago and are now showing up. And so the people who are going to show up in 2 weeks from now are people who are getting the infection right now.
What does that tell us about the idea of flattening the curve, which is so important?
It's going to take some time. So if you think, just by rough math, if you think there were 5,000 cases 2 weeks ago, some of those are now presenting to the emergency rooms, and doubling time was every 4 to 5 days. You could do the math on how many times you've doubled 5,000 to 10,000, 10,000 to 20,000, 20,000 to 40,000 over those intervening weeks. And so you might be at the case right now, you have tens of thousands of cases in New York, and even though we're now breaking off chains of transmission and slowing the rate of transmission, those patients still need to work through the system. They're still going to get sick, and some of them are going to present to the hospital. And I think we're about a week or two away from really seeing the hospitals at the point of maximal capacity and really at the sort of inflection point in terms of what they're capable of handling. They're getting close to that right now, probably a couple more weeks away from hitting that precipice.
What does that tell us about how long we're going to be in our homes, Dr. Gottlieb?
Probably for a little time now. I mean, it's hard to envision, having put our foot firmly down on the brake, picking our foot back up before we start to turn the corner in terms of the slope of this epidemic. And we're probably not likely to hit the peak in terms of new cases until sometime in April, maybe mid-April, in an optimistic scenario, probably closer to late April. You'll be coming down the epidemic curve. I think the key now is to define how we take our foot off the brake. How do we substitute in case management strategies, the ability to do very wide-scale screening and isolate people and isolate individual cases, as opposed to these broad-based mitigation strategies where you're basically dealing with people as a population. So right now we're trying to deal with this at a population level and restrict everyone's movement. What we need to do is move towards a posture where we're substituting in technology to just isolate the people who have the infection or are likely to have the infection. That's what South Korea did with a lot of success. They had broad mitigation strategies. They closed their schools. They cut back on business, but they didn't shut down their country. What they did was they had very aggressive screening. They identified people who had the infection and the people who were close to the people who had the infection, and they isolated them. We need to move towards that kind of posture, and that's what's going to let us slowly take our foot off the brake.
And news tonight that someone in the vice president's office has tested positive. Your thoughts?
Well, I've been in the West Wing, been there recently. It's close quarters. People work in close proximity to each other. They did implement over the weekend measures to start to take greater care principles. They had that in place before, but they implemented even stepped-up measures at social distancing and to take greater care of the principals there. And I think they ought to do that. I think they need to keep people out of the West Wing whenever possible, have meetings at the old executive office building where they can, not have visitors coming into the White House. Congress needs to do the same thing as well. I was on Capitol Hill last week briefing members of Congress on both the Democrat and the Republican side, and felt that they need to be doing more to protect the members as well. And they've stepped up measures, too, in the interim, but I think they really need to think about how they keep people away from members of Congress and principals in the White House to protect those individuals while we're really in the peak of this epidemic over the next couple of months.
We're so concerned about what's happening inside our hospitals, not only the scene, but how hospital workers themselves are dealing with all of this. I understand you had a chance to speak with some doctors on the front lines in New York City. Can you take us inside the hospital?
Well, I talked to doctors in the city, as you're right, as you said. They're admitting a lot of cases. This one hospital I talked to had admitted about 100 cases. About a third were intubated. And what they're seeing is these aren't necessarily the patients that you'd expect. I mean, we have a view in our mind that it's older individuals who are getting hospitalized and getting in trouble. If you look at all the data, and we've talking about this for a while, it's actually a lot of middle-aged people getting hospitalized with this. Older individuals are the ones who are succumbing to the infection at higher rates, but a lot of middle-aged people are getting hospitalized for it. And so they were seeing mostly 50 to 65-year-olds and some people in their 30s, mostly healthy. And what they're also seeing is that people who get into trouble quickly. So they might present with difficulty breathing and pneumonia. They might be desaturating, meaning they have low oxygen in their blood, but not terrible. And then all of a sudden, over a short period of time, they decompensate. And what it probably is some combination of an inflammatory response from an immune response. Basically your immune system isn't used to seeing this virus, and it mounts a very aggressive response in an otherwise healthy individual. And it's the immune response itself and what we call a cytokine release that's doing damage to the lungs and pushing these patients almost into a sepsis-type picture where it's called acute respiratory distress syndrome, where their lungs fill up with fluid and get damaged very quickly. So I think what you're going to see is the threshold for hospitalization is going to go down, meaning patients who might have low oxygen in their blood, but not really low. They might be able to be managed at home. They're probably going to want to admit more of those patients, recognizing that it's unpredictable who's going to get into trouble. And that makes this a little bit more frightening of an illness, that it's hard to predict the clinical course of the people, who's going to be okay and who's going to be bad. From a medical standpoint, if you're a physician, that makes it more difficult to manage the care of patients.
And lastly, we've heard from some doctors scenes described in Italy where doctors have had to make difficult choices because of the overcrowding and some of the conditions of who to try and save and who not to. Are we going to get to a situation like that, Dr. Gottlieb, in the United States?
I certainly hope not. I mean, we have more capacity than Italy, certainly. I put up some data on Twitter today about the number of ICU beds we have per capita, and we're in stronger shape than some of those other nations in terms of our ability to deliver critical care. Now, a lot of that critical care is occupied right now. We need to free those beds and find ways not to do things that are elective. We really need to cut back on elective surgeries. We also need to increase the flow in hospitals and find places to discharge patients to safely, including COVID patients. But we're going to come up against the capacity of our healthcare system. The question is, how far over that limit will we get? And hopefully we won't get too far over the limit. Now, that's what the mitigation steps are about. They're about slowing the spread of transmission so you can decrease the rate of new infections to the point that the healthcare system can keep up. I will say we really need to think about, we're talking about all these bailouts and the massive stimulus. We need to think about how we can get massive resources into the healthcare system in these hotspots. It's not every city, but it's the cities that have outbreaks and large epidemics, and New York is probably at top of that list.
Are you heartened by the GM news we're learning tonight that they will start making ventilators?
Yeah, and we should be thinking about that on a wider scale. A lot of the things that are in shortage right now are not complex products. I have a hard time understanding how we can't find manufacturing capacity in this country to make surgical masks and find other ways to convert over facilities very quickly. You think about what we did in World War II in terms of facilitating the quick manufacture of products by converting facilities. We should be able to do that here. When it comes to diagnostic testing, some of the components that are missing are things like pipette tips we're short on. We have 3D printing. We have capacity to convert manufacturing lines to do that kind of very low margin, low tech manufacturing in this country. We ought to be doing that on a wide scale wherever possible.